So I mentioned in a video I did earlier that I've tried since yesterday on several occasions to post a certain video on TikTok that, well, it showed a document from one of those organizations I mention a lot that blocked me. So I'm gonna try to just tell you what the document says, and see if because the video, no matter how many times I think 6 times I've tried to post, it lets me post it, but it's 0 views. You can tell when they're shadow based. So what it tells me, because I mean, I still post it on Rumble and on my YouTube channel and on Twitter, but to not get any views is unusual. So what it tells me is that organization that I've mentioned, the organization that blocked me, has had a lot of power, too much power, and they've had a big hand in, because they've been on board with the globalist agenda. I feel like if I had a dime for every time I've mentioned globalists, I would be wealthy, because it's a big, big deal. It's communism, but the worst kind you can think of, but on a global level. So most people that are awake understand this, okay? But what I'm trying to say is that this is why this organization has blocked me, because I have challenged them about they're not being, first of all, they're not being honest. They're not able to obviously put priorities in line. Like, you can't, one of the things in the document, it was about their stance that, yes, immigration is a divisive issue politically, but their stance is that we need to, so we can have good outcomes, we need to protect, we need to make sure that whether documented or undocumented illegal immigrants, that they have health care so they can have good outcomes. So one of the ways this doesn't make sense is because it's overwhelming the healthcare system. So in 2020, you heard how we can't overwhelm the healthcare system. So then that organization is hypocritical, because they should be standing against open borders, because that will overwhelm the healthcare system. So they don't really know how to prioritize, first of all. And second of all, there's no way they don't know that when you have an open border, you have mass amounts of trafficking going on. And as a nursing organization, that should be the number one thing. We're supposed to try to do our best to prevent harm. So carrying on about how everybody that's coming across the border needs to have health insurance is just a way to force the government to come in and do one payer system. It's wanting to usurp what we the people want. That's what. So that they have a lot of power, obviously, because TikTok won't let me. It'll let me post it. They won't let it get seen though by anybody. So I'm just going to tell you, this was, it's part of because this organization is with the United Nations and the World Health Organization. And this was, I'm not sure the date of this, but they go back to being involved with the Agenda 20, the Green New Deal, since the early to mid 2000s. They're resolved as nursing beyond borders, healthcare for documented and undocumented immigrants living in the U.S. Resolved that, I'm not going to say the name of the organization that blocked me, but it's my profession. I've mentioned, if you follow me, I've mentioned it enough times. resolved that blank association will reaffirm its position that all individuals living in the U.S., including documented and undocumented immigrants, have access to health care, and resolved that this association will educate nurses regarding the wide-ranging social, economic, and political ramifications of undocumented immigrants' lack of access to health care services. I'm sorry, this was 2010. 2010. So that's why they don't stand. So this is a very obviously powerful organization. I mean, clearly they are, given what they did to me 12 years ago. Well, Illinois nurses, I don't want to say, but I mentioned it in many videos. So it's all about health equity, which is that racist agenda, which it is. This was all brought, it was all planned with the hospitals, with the CEOs. Now, the people at the bedside don't know. They don't. They just believe whatever these people say. They don't realize that if you look into them, no, they've been on this path. So it says a little further down here, it says, by taking this position, which is that immigrants and their health disparities, this organization joins with other international nursing organizations in promoting health care for all migrants, illegal immigrants. This idea that they're changing it to everybody coming across the border is an illegal alien. And then they have in parentheses, International Council of Nurses, 2006. It also remains faithful to its ethical responsibility as a professional nursing organization to speak collectively for nurses. They don't speak for me. They don't. The very fact that they would say they speak collectively for nursing is rather arrogant. I don't imagine that every nurse would agree with. I think that there's some nurses out there that would agree with me. Yeah. So I've said this before on my YouTube channel. I would really appreciate it if they stopped saying that they speak for nurses. Say that you speak for maybe your members, but they set the standard of care. So they collectively for nurses in affirming the dignity of all people, irrespective of their life situation. So if they were ethical and cared about in affirming the dignity of people, then they would say shut the border down, because part of caring is caring about not wanting to see people trafficked. That's the kind of the worst abuse you can do to someone. It's slavery, whether it's for sex exploitation, child slavery, you name it. There's all different ways they do it. And with an open border, that's what leads to tons of trafficking. Instead, they want to ignore that and just focus on getting everybody that comes across the border health care, because they want one-payer system. Again, it's about their socialism plan with the Green New Deal. So usurping what the American citizens want, or they don't care about that, which is likely why I'm getting blocked, why I'm getting silenced. It's just that when I don't get any views, that tells me they have a lot of power and way too much power. And I'm sure there's people, ethical people, in places that are not yet known that know this. And it'll eventually be handled, is my opinion. There was another page to this. I just wanted to read the first couple of lines because I think it tells you who they're dedicated to. It's under health statistics. Most immigrants come to the U.S. to find work and are usually younger and in better health than their counterparts who are U.S. born. Their health status deteriorates over time, however, due to a number of different factors, including poor access to health care, limited access to medical services and public health programs, results in poorer health outcomes for immigrants and their children. Yeah, so basically saying that they're healthier than the American people. So then it seems like really they only serve certain people, and it's not the people that actually live or are legal citizens in this country.